Quality. Quality is not a simple thing to define, but it is something that probably is best measured by the customer, by the client, or in our case, the patient. So in the world of anatomic pathology, quality is simply getting the exact diagnosis to the correct patient as quickly as possible, no exceptions and no excuses. When we think about quality, the clinician, specifically the surgeon, is looking for answers. And the answers that they get from anatomic pathology will drive what happens to the patient the next portion of their surgery. We will get a phone call. We will be aware that there's a frozen section pending, and a transporter will then come out of the operating room. We are under a time standard. We have exactly 20 minutes by CAP regulation to get an answer back to that operating room. We will then take that specimen and make sure we understand the identity of the specimen first and foremost. Label slides accordingly. We will have a resident and an attending pathologist present. They will take the specimen. They're going to find the component of the specimen that is most abnormal. We will do a rapid freezing process on that specimen at an instrument called a cryostat, and from there the specimen will be cut into micrometer thicknesses. The slides will be stained in a rapid staining method. And for example, we have a patient in the operating room that has an ovarian mass. That means there's a family in the waiting room that's waiting to see, does my wife, does my child have cancer? Are we going to be able to have children or grandchildren? And we have that answer for them. We take the slides to a multi-headed microscope. Everyone gets around that microscope and we have the answer for the family at that moment. We can call the surgeon and say, this is a cystic mass or this is a benign mass. The patient does not have cancer. We can save the ovary. We can move on with the surgery, understanding the benign diagnosis of that mass. And that's very rewarding for us. That's a very rewarding part of our day. And it's probably the most connected, the most directly we are impacting patient care in anatomic pathology.